Happy morning to everyone. I am Malathi, Assistant Professor in Child Health Nursing Department in E.S College of Nursing, Villupuram. Today we have to discuss about the topic of safety indicators in children. What is meant by safety? You have to provide by the safety by the children in the sense all the aspects you have to given the safety. In the sense you have to maintain by the physical, or you have to go for the psychological safety. You have to given by the any personal safety measures have to provided by the child, in the sense that this comes under by the safety. You have to you have to see about the safety indicators. Why you have to provide it by the some of the indicators to the children, in the sense the child safety indicators comes under by the way to improve the child health. You have to provide by the healthy care to the child, in the sense that this comes under by the way to improve the child health. The child safety indicators in mainly focus on the maternal as well the child health. The way to improve the child health, in the sense how you have to provide it by the care, how you have to providing of the exposure, and how you have to speak, and how you have to learning about the things, in the sense that is you have to maintain by the child health. And afterwards you have to maintain by the safety indicators in mainly focus on the maternal as well the child health. Not only focusing on the child, you have to most precious about the maternal, also have to focusing on the care. The importance of maternal child health indicators, in the sense the maternal, what are the maternal indicators as comes under, in the sense maternal mortality ratio have to maintain, and stillbirth rate and perinatal mortality rate and neonatal mortality rate you have to provide it. The post neonatal mortality rate is comes under by the newborns, and infant mortality rate and child death rate you have to adjust, and mortality rate is comes under by the some importance indicator of the child indicators. Why maternal and child health is important, in the sense vulnerable a specific group and continuum of the care. The mainly focusing of the vulnerable group is called as a maternal and child. That's why we have to main focusing and main importance in this child safety, and you have to indicators have to maintain by the mother as well the child. In the sense you have to maintain by the some reproductive health of the woman. After it go for the reproductive health, you have to go for the maternal. The maternal factors afterward deliver the baby comes under neonate, and the neonate has comes under by the child. After you have to go for the adolescent. Have to go through again adolescent has comes under by the reproductive age group, and again have to comes under by the maternal, and again have to comes under by the neonate and child and adolescent. The routinely processes comes under by this maternal and child health. That's why the maternal and child is important to the main specific care have to provided by the a special group, that is main vulnerable group have to give the some indicators. The introduction of child safety indicators, in the sense in today's presentation we will explore and effective strategies for enhancing child safety. This is critical area that demands our attention and action. Have to maintain by the critical area of demands and our attention and action, in the sense the critical care, in the sense you have to provide critical area, in the sense you have to given by the mainly focusing on the affected area is comes under by the critical area. The child safety indicators, in the sense understanding the incidence rate of the child abuse and neglects, as well as the prevalence of childhood injuries are crucial indicators for assessing the child safety. The understanding the incidence rate of child abuse and neglects, in the sense you have to understand when the baby is as comes under by the abused. You have to prevalence of child injury, and you have to maintain the crucial indicator for assessing the child safety. The risk factors have to maintain by the child safety indicators, identify and addressing the risk factors such as parental substance and abuse and domestic violence and poverty is essential in promoting and child safety and well-being. As productive factors, in the sense you have to give the some protection of the children's, highlighting the role of supportive communities and positive parent-child relationship have to maintain, and assess the quality early childhood education as productive factors in ensuring the child safety. The preventive strategies, in the sense implementing the comprehensive child protection policies you have to maintain. What the prevention have to maintain by the child safety, in the sense have to maintain by the some protection policies, promoting the parenting education. Have to give some education to the parents how you have to take care of the child, that is parenting education. Enhancing child advocacy effort or vital prevention of strategies for safeguarding children. How to education and awareness program have to provided by the children's. In the sense, raising the awareness about the sign of child abuse and the importance of reporting suspicions of empower individual to take a action in protecting the children from the harm. In the sense, how to maintain the awareness of child abuse, how the importance may have to role, a main role have to suspicions can be empowered by the individual children's. A legal framework have to form in the establishment of enforcing the child protection laws and regulation to hold the preparatory accountability and ensure the rights of children are upheld within the legal system. The collaborative efforts you have to maintain. The fostering collaboration among the government agencies and non-profit organizations and communities to create the unfilled approach in the addressing the multi-faceted aspects of child and safety. Technological and safety in the sense, how to arranging the technology in the sense to enhancing the child safety and measuring includes online safety protocol, GPS tracking devices and digital platform, and for reporting the child safety indicators. You have to technology safety in the sense, most of the children have mainly focusing on the television, media, mobile phones. In the sense, you have to most of the babies has to affected. You have to mainly focusing on this, how to off the some of the notification of wrong notification of the mobile phones. How to maintain by the some safety measures including the online and safety protocols. You have to maintain by the GPS tracking in the sense what the baby has to use in this mobile, that you have to assist. And you have to measuring the impact of the child safety indicators. Utilize the data driven assessment to measure the effectiveness of the child safety initiatives and identify the area for importance in safeguarding the children from harm. The utilizing the data determine the assessments measure effectiveness of child safety initiated in the sense, you have to identify the importance of safeguarding the children. Why the children is safeguarded? Today children is tomorrow India. We have to know that is the you have to impact and you have to importance as provided by the measuring of child safety. The physical safety in the sense, you have to provide frequent injuries and poor hygiene and sign of malnutrition. The frequent injury in the sense, baby have go for the external environment, playing or jogging or running or rising the some of the behaviors, have go for the assault material, have to, that is the frequent injury. And poor hygiene in the sense, baby should not maintaining the poor bad habit. In the sense, you have to children who are not neglected may not be bathed or have rather than the cloth change regularly, are not brushing and have to not maintaining the personal hygiene is comes under by the poor hygiene. The sign of malnutrition in the sense, this is could included being underweight, having a distended belly or having a dry and flaky skin. The malnutrition in the sense, we have to know, they have to deficit about the protein energy malnutrition. I have to comes under by the decreased amount of calories and decreased amount of protein have maintained that is comes under by the some physical safety. As emotional safety in the sense, you have to changing in the behavior, difficult to concentrate in school and nightmares or sleep problems and loss of appetite or changing in the eating habits and taking about the self-harm or suicide. The changing in the behavior in the sense, what you have to good including withdrawn from the social activity and aggression. The mainly have to change the behavior in the sense, the using of mobile phones. I have to using of any televisions. I have to go for the video games. This comes under by the some changing of behavior. Have not interacted with the other. You have to should not maintain by the interpersonal relationship. You have to should not maintain by the communication to the relation as well the parents. That is how to develop by the social activity, withdrawal social activities. Have to maintain by the increased of aggression. The difficult concentration in the school in the sense, this could be a sign that child is worried, upset about and something. Have to comes under in this home setup, the baby has to keep on playing in the mobile phone and go for the school in the sense, the school is not having mobile in the sense, have to worried how I can go for play and how I can use my mobile. In the sense, baby have to difficulty concentrating on the schools. And nightmares and sleep problem in the sense, this can be sign of anxiety and stress. The nightmare and anxiety in the sense, that is one sign of anxiety or stress and depression may have to develop. And loss of appetite or changing in the eating habits in the sense, this could be sign of depression or anxiety. If in case if the baby is keep on in the playing on one particular area, in the sense they have to not eating properly. And taking about the self-harm and suicide, the child is taking about the hurting themselves. How they have to taken by this taking about self-harm and suicide, in the sense the recently they have to comes under by the games, that the games have to develop by the some of the mental pressure, should not achieve the task, should not achieve the goal, in the sense baby has to, I'm failed, I'm should not achieve the particular goal, in the sense they go for the suicidal attempt. They have to go for the self harm. I should not done this particular project, I should not done this particular game, in the sense that is comes under by the have to comes under some suicidal thought, had to self harm have to develop by the children. The call to action, in the sense it is imperative that well collectively prioritize the safety and well-being of the children. So let's commit to taking a tangible action to create a safer environment for our future generation. And the behavior changes. Withdraw from the social interaction and activities they used to enjoy. A sudden changes in mood or behavior, such as becoming aggression, withdrawn and clingy and bedwetting and nightmares that develop after creating the age, and running away from the home or school. And the last, I have to conclude my child safety indicators. It is, you have to see about the conclusion and enhancing the child safety requirement requires a multi-faceted approach and encompassing the awareness and prevention and collaboration method. We have to give the some advocacy, and together we can create a safety world for all the children. Thank you.